Here are 10 Puerto Rico Medical Board style clinical vignettes focused on physician-patient communication and ethics, with 4 answer choices and explanations. Physician-patient communication and medical ethics, clinical vignettes. Informed consent and capacity. A 67-year-old man with mild dementia presents with a hip fracture requiring surgery. He insists he doesn't want the procedure, but his daughter says he's not thinking clearly. What should the physician do first? A. Proceed with surgery based on the daughter's wishes. B. Assess the patient's decision-making capacity. C. Ignore the patient's refusal and obtain consent from the family. D. Obtain a court order for the surgery. Answer B. Assess the patient's decision-making capacity. Explanation. Patients with mild cognitive impairment may still have decision-making capacity. Capacity assessment should focus on understanding, reasoning, and expression of choice. 2. Breaking bad news. A 45-year-old woman has just been diagnosed with stage 4 pancreatic cancer. She looks anxious and asks, "Doctor, how much time do I have left?" What is the best response? A. You only have a few months left, so prepare yourself. B. I don't know, but let's focus on treatment options. C. I understand this is difficult. Just specify, would you like to discuss your prognosis? D. Don't worry about that right now. Answer. C. I understand this is difficult. Would you like to discuss your prognosis? Explanation. Breaking bad news should be done with empathy, allowing the patient to set the pace for the discussion. 3. Patient autonomy versus medical advice. A 52-year-old man with newly diagnosed diabetes refuses to take insulin, saying he wants to control it naturally. What is the best approach? A. Insist that he must take insulin immediately. B. Respect his decision, document it, and provide education on the risks. C. Refuse to continue seeing him as a patient. D. Call his family to convince him. Answer B. Respect his decision, document it, and provide education on the risks. Patients have autonomy in their treatment decisions. Physicians should inform them about risks, but respect their choices. 4. Confidentiality in adolescence. A 16-year-old girl requests birth control pills but does not want her parents to know. What is the most appropriate response? A. Prescribe the birth control and maintain confidentiality. B. Tell her parents before prescribing the medication. C. Refuse to prescribe the medication without parental consent. D. Call Child Protective Services. Answer A. Prescribe the birth control and maintain confidentiality. Explanation. Minors have the right to confidential reproductive health care in many jurisdictions, including contraception. 5. Physician error and disclosure. A 68-year-old woman underwent a procedure, but that the physician later realizes an incorrect dose of medication was given, though no harm occurred. What should the physician do? A. Inform the patient about the mistake, even if there was no harm. B. Say nothing, since no harm occurred. C. Document the mistake, but avoid telling the patient. D. Apologize, but avoid giving details. Answer. Inform the patient about the mistake, even if there was no harm. Explanation. Ethical practice requires full disclosure of medical errors, even if no harm resulted. Transparency builds trust. 6. End-of-life care and DNR orders. A 74-year-old man with terminal cancer is unresponsive in the ICU. His living will states he does not want CPR, but his son demands full resuscitation measures. What is the best course of action? A. Follow the living will and do not perform CPR. B. Perform CPR to respect the son's wishes. C. Seek an ethics consult before making a decision. D. Ignore the living will and continue life-prolonging measures. Answer A. Follow the living will and do not perform CPR. Explanation. A valid advance directive takes precedence over family wishes. The physician should honor the patient's autonomy. 7. Ethical dilemmas in organ transplantation. A 55-year-old man with end-stage liver disease due to alcohol use is evaluated for liver transplantation. He recently relapsed after 6 months of sobriety. What is the most ethical approach? A. Automatically deny him a transplant due to his relapse. B. Refer him to an addiction specialist and reassess candidacy. C. Proceed with transplantation immediately. D. Place him at the bottom of the transplant list. Answer B. Refer him to an addiction specialist and reassess candidacy. Explanation. Transplant decisions should consider medical and psychosocial factors, not automatic exclusions. 8. Conflict of interest in industry relationships. A physician is invited by a pharmaceutical company to an all-expenses-paid conference on a drug they manufacture. What is the most ethical response? A. Accept the invitation and enjoy the free trip. B. Accept but only attend the educational sessions. C. Decline the invitation due to potential conflict of interest. D. Ask for a larger honorarium to attend. Answer C. Decline the invitation due to potential conflict of interest. Explanation. Accepting gifts from pharmaceutical companies can create bias and affect patient care. 9. Cultural sensitivity in healthcare. A 35-year-old Muslim woman refuses a male physician for her exam, stating it goes against her religious beliefs. What is the best approach? A. Explain that gender does not matter in medical care. B. Assign a female physician if available. C. Refuse her request and continue with the exam. D. Tell her that religious beliefs should not interfere with healthcare. Answer B. Assign a female physician if available. Explanation. Respect for cultural and religious beliefs improves patient trust and adherence to medical care. 10. Treating a colleague's family member. A physician's close friend asks for a prescription for antibiotics for a suspected UTI. What is the most ethical response? A. Prescribe the antibiotics as a favor. B. Conduct a full evaluation before prescribing. C. Refuse, citing ethical concerns. D. Ask another physician to prescribe instead. Answer B. Conduct a full evaluation before prescribing. Explanation. Physicians should follow standard medical practices and avoid informal prescribing without proper evaluation. Key takeaways for physician-patient communication ethics. Informed consent. Assess decision-making capacity before overriding patient autonomy. Breaking bad news. Use empathetic and patient-centered communication. Patient autonomy. Respect refusals, but ensure informed decisions. Confidentiality. Minors may have confidentiality rights in reproductive health care. Medical errors. Full disclosure is essential, even if no harm occurs. End-of-life care. Advanced directives should be followed over family wishes. Organ transplantation. Evaluate each case fairly. Avoid blanket exclusions. Conflict of interest. Avoid industry gifts that could bias medical practice. Cultural sensitivity. Respect patient preferences for gender-concordant care. Prescribing for friends' family. Follow professional guidelines and avoid informal treatment.